Morning, and I've got a very, very well informed host in the like of Mel Gab from the Family Planning Association UK. So she's going to be joining me today to talk about everything family planning and sexual health. So to start off with, I would like to first of all say that family planning and sexual health is very huge in the agenda, the NHS agenda, but also the government agenda as well. Why is that, you might add? But the point is because every £1 of the NHS money spent on prevention and treatment saves the NHS £11. So if you add the maths up, you can actually see why it's important that, we promote, raise awareness, and also make sure that people are fully informed about family planning and especially sexual health going forward, because there's a cost savings there. But at the moment, there's also a 20% increase in cases of syphilis, and in just 1 year there was a rise also in other sexual health conditions. So early detection and frequency in testing is paramount and shouldn't be taken lightly. So on that note, I would welcome my host, Mel Gab. Mel Gab is the project manager for Family Planning Association UK. Family Planning Association UK, shortened form FPA, is a big organization in the UK that has funding from the government and various other work streams, and so they're very, very well informed. They're very good in terms of what they do, and she'll be joining me to talk about family planning and sexual health today. Good morning, Mel. Hello, good morning, Mel.
Oh, hello, can you hear me?
I can hear you very clearly. Hi, good morning. Thanks for joining me today on the Health and Wellbeing Show.
You're welcome, and thank you for such a nice introduction about our organisation.
My pleasure, my pleasure. So, Mel, I'm sure you heard, I started off with actually just putting things into perspective in terms of why it's important to actually talk about having discussions like this about family planning and sexual health, because I see the whole family planning and sexual health as twofold, because there's, for me, one naturally doesn't happen without the other, or thinking about the other. Am I correct to assume that as well?
Yes, sexual health and family planning is much wider than going and getting the pill from the doctor so you don't get pregnant. So sexual health really broadly can be anything from delivering sex education in schools so that children know about growing up and how to stay safe, teaching people about consent so they learn to respect each other. There is choosing if and when you want to become a parent, knowing what your options are if you become pregnant unexpectedly, how to prevent yourself from catching an STI, but also treatment and testing if you do. And then there's also other things like smear tests, getting screening for early detection of things like cancer, and keeping well right up until you're older with things like keeping a prostate healthy and stuff like that. So it's a massively wide topic.
Totally. With everything else, I think when we're talking about, for what we're talking about, family planning and sexual health, health in the main, even if you're, even if you're talking about a particular topic, it depends on what angle you're going to be coming from. Like you said, family planning and sexual health is a huge and massive topic. But I'm going to try with yourself, we're going to try and discuss about sort of the generic things and the generic take that we need to be made aware of consciously, and also what does this family planning and what does sexual health mean? Because I always want to start off to say health means different things to different people. I might think, this is what health means to me, but then trying to relate that to someone else might think, well, this is not what I think of health. So things like this, having this sort of conversations with yourself and putting stuff out there that people will actually think, oh, wow, I never thought about this way, is always very good, and it always also raises a profile of the agenda of family planning and sexual health.
Yes, you're completely right. Health can mean so many things, and it depends on the education you've had as a child as you were brought up, and the information you've received from maybe at school or from services that are out there. So you might think that your sexual health is really healthy, but you might not have been for a smear test in 10 years. So actually, there are still things that you can do to make yourself healthier.
Fantastic, fantastic. So, to start us off, Mel, what would you say in terms of, so someone's listening either on social media, via the social media, or actually just listening in online, what would you say family planning? What would you say to them? What is family planning? If they think, well, what is family planning? Rightfully, from what you've said, everyone's upbringing and sort of the conversation and dialogue we normally have growing up varies as well, and it varies on the household, how you're brought up, who was there, and who was the person who could have sort of that candid conversation about family planning and sexual health at that time, and also thinking that it's never too early to have certain conversations with children as they come up, as they grow up as well. So if someone was listening thinking, what is this family planning and what is it about, what areas does it include, because like we said, we alluded to in the beginning, it's quite a huge topic. What is family planning and what does it include?
So in a nutshell, family planning is about both preventing pregnancy and putting steps in place so that you can plan a pregnancy if you want to get pregnant at some point in the future. So so in terms of teaching people about family planning, often you think, oh, I'll just go and get the pill before I start having sex without a condom, and then that means I'm covered. But actually, it's really, really good to think of it way before you start having unprotected sex. So just the same way as you wouldn't let a child go out and cross a road on their own without giving them good advice about road safety for years before, it's a really good idea to give young people messages about their choices in terms of pregnancy prevention and pregnancy planning for the years before until they start having sex. So you can go, whether you've got a sexual partner or not, whether you're thinking about having sex in the near future or not, it's really good to know what your choices are about what's out there. So at the moment, there are 14 different methods of contraception available, and different methods might be appropriate for different people depending on what they need from their contraception, what their lifestyles are, what if they've got any medical conditions, and also things like smoking, your BMI, your age, things like that come into consideration as well. And just because you go on the pill when you're 18 doesn't necessarily mean you'll stay on the pill your whole fertile life, with gaps for having babies. Women can choose different methods of contraception throughout their entire life, and it could be, you use a long-acting reversible contraception like a coil in your early 20s, but then you might choose to have an implant later on, or you might have an implant in your teens and something else later on. So it's just different choices at different times to help you control your fertility.
Fantastic. Mel, you mentioned about, you mentioned about, what sort of conversation that we need to have with children growing up, but also you mentioned about maybe someone starting, going on the pill, on having the contraceptive coil inserted at 18 doesn't mean that might work for them long term, or it doesn't mean that this is how, they would want to carry on in terms of family planning and also their sort of alternative and methods of contraception. Now, as I remember rightfully, the teenage pregnancy rate in the UK, I think about 2 or 3 years ago, when I used to commission sexual health services for the Triborough, used to be one of the highest in Europe. I know that was the narrative for quite a while, and there was quite a lot of things that the government was doing. The NHS kind of been very innovative in trying to address that issue. So how is that now in terms of the rate? Because I can't remember if it's still the same. I think when I read a report probably a couple of months ago, it was still the same, that the rate is still quite high, but it's actually been reduced. It's actually, coming down quite a bit, because there are quite a few factors that they were thinking about. People more, younger people being more engaged on their phones and things like that, thinking about their lives and stuff like that. How is that now? How is that teenage pregnancy rate? Is it still the same, or how are you finding it as someone who works for the FPA?
Well, actually, you're right. Teenage pregnancy has dropped over the last 15 to 20 years, and it's actually come down about 60% within the UK. We're still really high up on the list of European countries. We've still got a very high pregnancy rate compared to quite a lot of other European countries, but it has dropped dramatically, and that's because of a series of factors. We had a targeted teenage pregnancy strategy put in place, and then there's improved sex education in schools, which of course will become better in 2020 when it becomes compulsory in the schools in England. And then there's more awareness about service being accessible for young people as well. So I've got a statistic here that says only 1.36% of young women aged under 20 in England and Wales gave birth in 2016, and whereas the general public usually thinks it must be about 20% or something, so it's actually quite low. And also women are accessing more abortions as well. So instead of just when they become pregnant, if they're 15, thinking, I must have the baby, there is more awareness about choices about what to do about their pregnancy as well.
Okay, fantastic. Now, the other thing that I was going to mention about as well, which I think things have moved on quite dramatically, and which is good, is actually having access to the morning after pill. I know the morning after pill is not a form of planned contraception, should I say? It's a form of contraception, but it's not a form of planned contraception, and I think it shouldn't be used as such. You know, some people think, well, you know, I'm not on anything, but if something happens, I'm going to go, you know, I'll go and get the morning after pill, which is good, but it shouldn't be used as a planned form of contraception. And what the government was trying to do at the time, and I think still so, is trying to make sure that the morning after pill people have readily available access to it by going to your pharmacist, going to your local walk-in centre, going to your GP, and places like that. And if you're struggling to get an appointment with your GP, then maybe looking at other areas where it's easy for people to go and get the morning after pill to prevent a potential pregnancy, maybe an unwanted pregnancy, but also that they know that if something happens, they can go and reach out and get the morning after pill. What are your thoughts about that, the morning after pill in its entirety, and also access to getting it as well?
Well, I think the morning after pill is absolutely essential. You know, people make mistakes. We're human. People have sex. They make mistakes. Even sometimes if you use a condom, if you've not used it properly, or very rarely, the condom can break. You know, so you have tried to be careful, but then an accident happens. And so emergency contraception is an absolutely essential safety net for women who don't want to become pregnant. So the name of a morning after pill kind of disguises how long you've got to take it. You've actually got up to 72 hours to take it, although it's most effective, it's about 95% effective if you take it within 24 hours. And the more places that you can get it, the easier it is to get quickly. So yes, you can get it from pharmacies, you can get it from GPs and walk-in clinics, and from sexual health services, and even at a push you can get it from out-of-hours services and casualty departments as well, because obviously they want, as you say, an emergency, every pound spent is money saved. Pregnancies can be very expensive, especially unplanned ones. So for the NHS, providing women with emergency contraception is an economically sound thing to do. But you're also completely correct. We shouldn't think of emergency contraception as planned contraception. I mean, it's the clues in the name, really, isn't it? Emergency contraception. So it's really, really good idea. If you find yourself needing emergency contraception, that should be a really good trigger for you to think, I don't really want to be taking this again, so let me have a think about what other contraception choices I've got that would suit me better than having to go and get emergency contraception. And just to add on to what I said about the emergency contraception pill that's for 72 hours, that is for the most easily accessible one that you can get in pharmacies. But you can actually get emergency contraception for up to 5 days, either the Ella-1 pill, which you can have up to 5 days, or a IUD, which is a copper coil, and those can be given to you for up to 5 days, but you probably have to access those through your GP or through your sexual health services.
Thank you, Mel. Saying that, just to piggyback from what you've said, so the 5 days of the IUD coil and also the LU1 pill,
yes.
I think if I'm right to say that sometimes with those two options, you find twofold. So one, maybe somewhere where, maybe someone has a, long-term medical condition and they've missed out on the 72 hours within the morning after pill. And also, same applies for the coil. But then I would always have to put in there that there's an issue sometimes with access, getting an appointment. So you talk about GP. For GP, we've got emergency appointments with GP surgery. But then if you have a GP that can't or doesn't have any sort of services to kind of insert, IUD coil, it means that you have to go to a family planning clinic. So how does that work in terms of if someone misses that 5-day period, then it's an issue in itself that they can't get access within the 5 days. But what would you kind of promote? So if they can't get access from the GP, what would you advise them to do so they can actually be able to get this sorted out within 5 days?
If they can't get their GP, although if they say to the when they try and make an appointment or walk in, if they say this is an emergency and explain what it is, then the GP should, if it's beyond the 5 days and they haven't got a person who can fit a coil on their staff, because you have to have extra qualifications to fit a coil, they should signpost you straight away to where you can get one done. And you can access you don't have to go to your own doctor for sexual health services. If you're worried that you might bump into your auntie or the person who's working on the reception, then you can visit another medical practice and ask for services from them. The best thing to do would be to ring up your local sexual health services and say, where can I get this treatment quickly? And you can find all the numbers for those services on our website, fpa.org.uk. And we've also got a clinic finder tool where you put in your postcode or where you live, and it'll bring up your local clinic and the contact details. And I think it's got the times that they're open as well. So that means you won't have to go round searching, trying to find a service in an emergency. You've got a one-stop shop for being able to find what you need.
Fantastic. Thank you for that. Now, I read also in a report, I think there's a report in Sweden that talked about, because of everything that's going on in terms of technology and accessibility and, everyone needing to have an app to check on everything, so to speak. You need to check on the app, what's the app saying about this and what's the update and things like that. So there's a research that I read, I think, if I'm not mistaken, it's actually from Sweden, where they talked about pregnancy apps and also do they really work. Have you come across pregnancy apps, or how does it work? Because I've looked into it in terms of reading about the report itself from Sweden, but I haven't had to even just download to kind of see how this works and also kind of maybe critique the usability of it. So have you come across this, and what are your thoughts about it?
Yeah, apps are being very trendy now, aren't they? And we won't be able to eat, sleep or go to the toilet without an app telling us soon. So fertility apps are basically a form of natural family planning, and natural family planning as a concept has been around years. Basically, women's cycles, that we have periods and there's certain times of our month that we're less fertile than others. So a fertility tool or a fertility app will track your fertile and your non-fertile days, and it will tell you when you need to use an additional method of contraception such as a condom to have safer sex so you won't get pregnant, and when it's okay to have pregnant without using an external form of protection. So the fertility apps ask you for things like your temperature and your day of your first period, and you plot in information every day, and it'll tell you when it thinks that you are safe to have sex without condoms. So they are very popular, and lots of apps use the word natural, which everybody automatically thinks is a brilliant thing. But just because people use medicine to stop themselves having babies, using contraception, doesn't necessarily mean that's bad. I mean, sugar and salt are natural, but we all know that they're not brilliant for you. These contraception apps, they can really work for some women if their menstrual cycle is absolutely the same every month. If they ovulate on the same day, if their period starts on the same day, if they're very predictable, if you've got a predictable lifestyle, if you wake up and take your temperature at exactly the same time every morning, if everything's the same. But if you're a woman who might ovulate on a different day, or you've got a more chaotic lifestyle, or sometimes you like a lie-in on a Sunday and you don't take your temperature till 3 hours later, then the apps won't get accurate information they need. So we reckon the app's failure rate is about 24%. So if 100 women use this app a year, 24 of them will get pregnant in a year, basically. So although it would protect 76% of women, 24% of women will get pregnant. So I think it's something that you need to look into very carefully before you use, and you need to make sure that you really understand properly how to use it, and maybe look on some online tutorials and things, because just starting it, thinking, it's going to stop the pill, I'll use this instead, leads to a much higher failure rate.
Fantastic. So like everything else, word of caution, always look at what you're downloading and where you're getting your information from, as Mel said. And also I think the other thing is that always be aware that if you haven't got, especially with family planning, if your cycle is not the same month in and month out, and also if there's other stresses going on as well and other medical health issue that maybe you might not be aware of, always think about all of these things that can also affect, the sort of validity of an app. So you're actually saying, okay, I'm just going to stop my family planning contraception pill or whatever method you use, and I'm going to rely on an app. The word of caution is always make sure that you know what it is. You can probably try it and also still be on your family contraceptive pill or method that you're using, but don't come off it thinking that this is going to be the be all and end all of it all.
No, it's not as effective as some other methods of contraception. I mean, that is evidence-based. It isn't as effective as other ones. If you definitely don't want to become pregnant, I'd look at it very, very carefully first. It can actually be a very useful tool if you are trying to get pregnant, in the terms that it can give you indications of when you're likely to be ovulating and therefore be most fertile. So lots of people use it for that quite successfully, but there have been accidental pregnancies for people who didn't want to get pregnant.
Okay, so always be mindful, always be careful. Now, leading us right through, we're going to also touch on the topic of sexual health, because I said in the beginning that we can't talk about family planning without sexual health. Sexual health is a key part of most people's life, sexual health is, and so we would be talking about sexual health with Mel, and also talking about sort of the new trends, what should we be looking out for and what should we be thinking about. So let's have a little break and then we would talk about sexual health. But to lead us into the break, I would want to also say that sexual health, one thing that we also have to be mindful of is that when we look at people, sometimes people say, well, sexual health, this doesn't appeal, this is not for me, I'm okay, I'm safe, I've got a new partner, I've got a partner, I've got my wife, my long-term partner, they're safe and everything's going fine, but I don't think they have any sort of sexual health infection or tendency or behaviors or whatever it is. So after the break, we're going to talk about sexual health, because I think it's also a pivotal part to family planning, but also our daily lives as well.
It was a well-paying job, respectable, wearing a suit and tie every day. But I drank 24/7. Drank on the way to work, drank at work.
I never could come to terms with admitting that I had an alcohol problem or a pill problem. I decided to get clean, and so I went to the Narconon program.
Not only did I handle my drug addiction, I completely knew how to live life.
Call Narconon today at 01435 512 460. 01435 512 460.
Luxury holidays, VIP event tickets, prestige cars. You can bid for them all. At lifestylebids.com, the lowest unique bidder for an auction item wins. With a small entry fee to the bidding room, bid for fabulous luxury goods, rare items, events and experiences. Lifestylebids.com. Who knows? Your unique lowest bid could mean you buy something for hundreds, maybe thousands of pounds less than its true value. Lifestylebids.com. Luxury at your price. Try it. Lifestylebids.com. This is a pay-to-bid auction site. Bid costs vary. Includes the cost of bidding and final closing price. Conditions apply.
Hi, I'm Dr. Macanjola from King's College Hospital, London. If you notice blood in your urine, even if it's just the once, tell your doctor. For more information, search Be Clear on Cancer.
You look elegant.
Thank you.
The hairstyle, the makeup, you change that every week.
It's Frida's Palace.
So, that's standing out. Look at your birthday party was Frida's Palace, right?
You got that. Hair and makeup for every occasion, anytime. Just walk into their Norwood Junction and Croydon salons or book an appointment by calling Frida on 07931 511 991 or 0208 6535 300. Consultation is free.
Can I take you out for dinner?
As your PA, I'll have to tell your wife you're asking me out.
It's just dinner.
I still need to tell your wife.
Frida's Palace. Look elegant.
Consider that life wasted. Consider the heart ripped out of a family. Consider the potential never realized. Are these the things you consider when you carry a knife? It's not about street cred. It's about staying alive. Drop that knife, save your life.
Hello, welcome back. My name is Fatima Kamara. You're tuned into the Health and Wellbeing Show. I've been having a conversation with Mel Gabb from the Family Planning Association. Mel is a project manager at FPA, and she's joined me today to talk about aspect. I wouldn't say everything family planning. It is everything, but family planning and sexual health is such a huge topic that in an hour or so we can't really do justice to it or actually address all the issues. But we're going to try and touch on key things that we think that really would be really useful for people to take away, but also to understand and to also raise awareness about the topic. So I've got Mel Gabb, and now we're going to be talking about sexual health. What is sexual health, and how do we why is it important to actually think that, why is it important for us to be very proactive in terms of our sexual health well-being, and not think that, well, you know, it doesn't bother me, doesn't show, I don't have any signs, I don't have any symptoms or anything, that, you know, it's okay. It's something that is there. You know, I have a new partner, I've got my wife or my long-term partner or my girlfriend or whatever it is, or your boyfriend, and you know, everything is going fine. We haven't got any issue here. We need to address sexual health because it's a huge topic. As I said earlier on when I started the program, every £1 of the NHS money spent on prevention and treatment of sexual health saves the NHS £11. So in its main, it's a no-brainer. It's not something that you think, well, you know, why do we have to do it? It is very costly if someone has a sexual health diagnosis, but also some sexual health conditions can take a long time to manage, and it's a long-term condition. So if we look at things like HIV/AIDS, last time I checked, it was actually maybe costing the government to kind of care for someone who has been diagnosed with HIV/AIDS will cost the government something along the lines of maybe 150,000 a year. So it makes sense to talk about it. It makes sense to be very proactive about it. It makes sense for us as individuals to take more responsibility in terms of our sexual health well-being. Would you say that's correct, Mel?
Yes, I would. STIs most of them can be treated. So STIs, sexually transmitted infections, all the germs that you can catch from having sex with another human being, basically. Most of them can be efficiently and easily treated if you catch them early. However, if they get left untreated, they can cause long-term health complications. So you mentioned HIV. HIV can be very expensive to treat, and if somebody somebody goes undiagnosed with HIV for a long time and it turns into an AIDS-related illness, then it can be very expensive and, of course, very traumatic for the person. HIV, the world of HIV within the UK has actually changed quite a lot in the last 10 years. So now you can get testing done so much easier. And we've seen a lot in the media in the last year or so, haven't we, with Prince Harry getting tested on telly and things, where you can go and get a simple blood test or a finger prick blood test done to test you to see if you've got HIV. If you are HIV positive and you are on treatment, then if you're on treatment, your viral load will be really low, and therefore you will not be infectious to other people. So that's the new thing that's come out really lately, is that if you're on treatment and the drugs are making your viral load really low, then you can't pass your HIV on to anybody else. It's the untested people out there who are passing on HIV to other people because they don't know they've got it. Their viral load will be higher and they will be able to pass on the infection. So it's really, really important to get tested, whether you think you've ever put yourself at risk or not. Just do it. Just go and get tested. Also, there's treatment out there for people who want to prevent themselves getting HIV. So for high-risk groups of contracting HIV, so for example, men who have sex with men, they can now access a treatment called PrEP. And it's like taking the pill. You take a tablet every day and it reduces your risk of catching HIV off a HIV-positive partner. So they're big changes that have happened within the HIV world. Although, if it gets less untested and untreated, it can cost a lot of money and be really, really traumatic for the person. But sort of less known about infections like chlamydia. So chlamydia is a bacterial infection and that you can catch from different kinds of sex. And if that's left untreated, it can really damage people's fertility. So if you catch it, for example, in your early 20s and you don't know you've got it, and about 50 to 70% of people who've got it don't get symptoms. If you don't know you've got it and it's left untreated, then it can affect your chances of having children in the future and is more likely to cause things like ectopic pregnancies. But in terms of treating, it's a simple blood test for it's a simple wee test for men, simple urine test, and it's a simple low vaginal swab test for women. And you can even go and get the test and go and do it in the toilet, and you don't even have to take your pants off in front of a nurse or a doctor. It's a very quick and simple test, and then if you've got it, you get a week's worth of antibiotics, and it's done. So it's another one of those ones that's good to catch early.
Okay, thank you for that, Mel. Now, you talked about testing in the main. There's been quite a lot of work done in terms of how, to make it really readily available for especially sexual health testing and also HIV testing as well. Mm-hmm. So I know with chlamydia and HIV test, you can actually, the credible companies that you can actually have, order online and the pack can be sent to you, and you can also do your test and then send it back to them. So if you're thinking, well, I don't want to go to my GP, I don't want to go to a sexual health clinic, then that's a way of testing it as well. So you can do like a mail out. I think you'd have to go online or speak to your GP or your GP practice, and they would signpost you to places where you can have that done and have the right results back to you, which I think is also good. So if people are busy or still have this sort of thing that I don't want to be seen, as you mentioned, then that's another way that you can actually counteract that as well.
Yes. So you can buy tests online. Some organisations do offer free screenings. So you just Google that and you will find out which ones will. You can buy tests from pharmacies. You can get tests done, basic screening done at your GP services. You can get a wider range of screening done if for your GP, you've got a very big GP and they've got enhanced services. Sexual health clinics as well, they provide full screening as well. Quite often, if you don't have symptoms, so you haven't got any rash or discharge or bleeding or pain, if you haven't got any symptoms, you just want a test to put your mind at ease, you will need a very, very simple thing. You'll just need a urine test or vaginal swab that you can do yourselves, and a blood test for HIV and syphilis. So they're very quick and they're very easy. And quite often you can get these tests done at your GP at the same time as you're seeing them about something else. So I'd say if you're going in for another reason, while you're there, get yourself an STI test so you don't have to make an extra journey.
Very good. And best practice, actually, I think best practice is best practice should be if you've got a new partner, if you are in a relationship, but you're thinking, well, I haven't had a sexual health screen before, it's always good to actually go and have a sexual health screen. You don't have to wait until you have your symptoms or your signs, which is good for you to go and have checked out anyway. It's best practice. I always say that, best practice, go to your GP. If you haven't, if you don't feel comfortable going to your GP, find a sexual health clinic and have a sexual health screen done, because with sexual health, it's not where you can only access sexual health screening from your GP. So if you lived in Kent, for example, and you felt, well, I don't want to go to my GP, but I don't want to use any sexual health clinics in Kent, you can come to London. That's one of the only services where it's not attributed to the area you live in. You can go wherever you choose to, as long as you go, and then you can be screened. You can most services would have two things. So they would have walk-in services. Make sure that you phone them in advance and just don't turn up, because sometimes if they get too busy, sexual health clinics, they would close their walk-in service because they would want to make sure that they see everyone that's coming on time. Or to kind of address that, you can actually phone up and make an appointment and then be seen at the time for the appointment. So that can be done. You can actually do that as well. The other thing, Mel, you mentioned about is MSM. So MSM, it's men who have sex with men. The narrative for me, when I've read quite recently and rightfully, I think in the past years, prior to maybe 5 years ago, the narrative was that men who have sex with men would be the ones who there's a higher rate of having HIV. But I think that rate has come down quite considerably, and now that is looking at a heterosexual couple or people who are having sex. They're the ones that actually the rate has come quite up and increased in terms of their HIV status.
Yes, you are absolutely right. So although men who have sex with men have got a high rate of sexually transmitted infections, and that's for many different reasons, one of which that we don't give appropriate safer sex messages to young men at school. We've had a very sex education at school has always been about preventing pregnancy and heterosexual sex. So lots of young people don't get the messages that suit their needs. So we need to look at the way that we deal with this whole education thing rather than blaming individuals for their behaviour. But men who have sex with men have traditionally had higher rates of STIs. But in terms of the population where it's increasing, that is heterosexual couples. So lots of people who have heterosexual sex, straight sex, will think, oh, I'm not at risk of this infection. HIV or syphilis is something that only gay men get. Well, actually, no. You've got a body. You can catch it, and it's the people who don't think they're putting themselves at risk. Maybe they're serial monogamists. They have long-term boyfriends or girlfriends, but have changed relationships every 2 or 3 years. They're the people who will often be at most risk of catching an STI.
Okay, very good, and thank you for adding that as well. I think the misconception also has been that sometimes people think, well, there's a misconception about who might look like someone who has a sexual health infection, which I think is a huge misconception. It's not like in the 80s with HIV, for example, where, you see someone with HIV or AIDS and they were looking very gauntly, you could actually see there was something wrong with them. But where medicine has actually improved and research has improved quite a lot, there are lots of people living happily and living well, should I say, with HIV and AIDS that don't look sick at all. So when you look at them, you can't really say, oh, this person looks ill. There might be something, sinister wrong with them. So I think in itself, that's very good. But one thing I would want our listeners, or if you're watching on on Facebook Live is that actually that we think we address the misconception that someone can look well, they can look dressed nicely and everything else, it's not attributed to any sort of status quo. This person is middle class, this person is a working, that sort of thing. It affects everyone because our sexual health practices vary. Doesn't matter whatever working class or whatever ideology you have. We need to address sexual health as just being sexual health. And also and the thing that I would always say, and I always say when I used to like I said, commission services and also done some family planning clinics myself as well, is I always say to people that if you don't take hold of your sexual health practices, what happens is, so you have a new partner, you have a partner who you've been with on a long-term basis, and you're having unprotected sex with that person, but remember how many people that person also has already had unprotected sex with. So when you're having unprotected sex or not actually taking responsibility of your sexual health, well, that means you're having sex with all the other partners they've had sex with, plus the ones that you've had sex with. So I think it's really, really key. So when you look at that, if you're thinking, okay, it's just me and this person in the relationship, think about, you might not be very sure of their history or where they're coming from, or their practices and things like that. Just think about that, and also think that family planning, sexual health, having your sexual health screening is very, very key, pivotal, and very crucial.
Yeah, you're really right there. I think we have made having an STI a really taboo issue, and we blame the person for catching the STI and doing something wrong. But the human race wouldn't be here without people having sex. Adults have sex with each other. It's what we do. It's a normal thing. So people who have sex can catch an STI just the same way that a person who goes into any room with any other person can potentially catch the common cold. So we need to reduce stigma about getting tested and about getting treated. Most people who've got STIs don't know they've got them, because most of them have got very few or easily missed symptoms. So it's entirely possible to have chlamydia and not realise you've got it for a very long time. The same with syphilis. It's really easy to miss the early symptoms of syphilis and not realise you've got it until much later on. So the only way to be absolutely sure you haven't got an STI is to go for screening.
Thank you. And that is key, very crucial in terms of checking your sexual health and sexual health well-being, but also in being sure that you actually address the issue of your sexual health per se. So it's really very important in doing that. So how have you found, so in terms of sexual health among teenagers or younger adults, and sexual health in sort of the over 30s. I know that there's a report that actually you can see how I kind of update myself and going to meetings and seminars and things like that. So there's a report that I read, and actually fairly recently, that things have now changed slightly in terms of sexual health responsible practice in terms of sexual health. So we have the over 50s now having an increased rate of STIs compared to the younger population. How are you finding it, Mel? How are you finding it in the FPA?
Well, if you look at any of the sexually transmitted infection statistics, the highest group that catch and transmit them to other people are your sort of 16 to 25-year-olds. They're the highest in that rate. And I guess they're the group of people who are having the most sex. But lots of people who are over 50 think, oh, well, I'm not at risk anymore. People my age don't have STIs. I might no longer be at risk of pregnancy, although that's not a given if you're over 50 and female. Your fertility declines slowly. It doesn't just get turned off overnight when you're 50. But people think, oh, I'm not at risk anymore, and they might have a long-term relationship breakup, and they might be out on the scene again looking for a new partner. They might start dating again, might start having sex with new people again. They didn't get sex education at school because it wasn't provided when they were at school. They they might have been in a monogamous relationship, maybe bringing up children when lots of the health messages were coming about STIs, so they didn't really listen to them. So it is an age group where infections like gonorrhea are rising and are being transmitted between people. So I know my local sexual health clinic, one of their oldest clients is in his 80s. So people are catching sexually transmitted infections over 50 and passing them on to other people. So it's about all the same safer sex messages apply. If you've got a new partner and you or they haven't been screened, use a condom until you've both been screened. If you are female and you haven't finished going through the menopause yet, then take a look at your contraception choices to make sure you don't get accidentally pregnant. Go and get, if you have different partners, go and get yourself a little sexual health MOT done regularly at your sexual health clinic to make sure that you haven't caught and you aren't passing on your STIs. It's just basic stuff.
Fantastic. Basic stuff that we need to keep talking about and reminding ourselves about as well, and making sure and actually thinking that is so crucial and so important that it needs to be done and needs to be done when it needs to be done as well. Now, in closing, I want to ask you, Mel, how have you found, what are the most common sexual health infections that you've found out, that are actually still on the scene? So chlamydia has always been a long-term one, as you mentioned, between the 16 to 24-year-old is quite prevalent, and also the management and prognosis and management of it, if it's actually left undetected, is really quite costly. So in terms of sexual health infections, as it stands, what are the most common ones? And if someone was listening and thinking, okay, what are the signs and symptoms? Because I know with chlamydia, sometimes there might not be any symptoms at all. Sometimes someone goes to have a sexual health screen and realizes, I've come back, they've given me a positive chlamydia result. Why didn't I know I had it? Who did I maybe pick this up from, and things like that? So what are the common sexual health transmitted infection as it stands at the moment?
I think the most common ones out there at the moment are chlamydia and gonorrhea, genital warts and herpes, and then at a much lower rate you get HIV and syphilis and things like that. So in terms of symptoms, what we tell people is first of all, you've got to know what your own genitals look like. So don't be afraid of having a look when you have a bath or a shower, and just acquaint yourself with what your body looks like when it's normal and it's healthy. And then that way you can tell if something's wrong. So, obviously that's easier for men than women, because men's bits are all on the outside and women's bits are more internal. But women, get a mirror, have a look at what you've got, understand what it looks like when it's healthy, what's normal for you. Take note of things like discharge and things like that, and just become aware of this is a valuable part of your body. You need to know what it looks like when it's healthy. And then if anything ever looks different, in terms of rashes, spots, sores, swelling, redness, this is for men and women, or feels different, if you get any pain when weeing, pain going to the toilet, if you get any bleeding during or after sex, or going to the toilet, of course, if any pain around bottoms, vaginas, penises, if you get any sort of lower tummy pain or lower back pain that you didn't have, get that checked out as well. And then if anything smells different, so if you get more discharge than normal, whether it's at your vagina or your penis, and it's different colour or it smells different, that might be a sign that you've got a bacterial infection. Or if you've just got any worries at all in that direction, then go and get yourself checked out at your local clinic or your doctor. So it's just being on top of things. Now, lots of these symptoms can be symptoms of other things. They can be symptoms of urine infections, of thrush, of non-sexually transmitted bacterial infections. So if you get something to do with your genitals and you think, I've got a sexually transmitted infection, it's just, don't be embarrassed about going to the clinic, because if it's not sexually transmitted infection, they can help diagnose what it is and get that cleared up too, because you don't want any sort of health problems down there that make you worry or give you pain or might cause long-term conditions.
Thank you for wrapping it around so nicely and bringing sexual health and family planning to the forefront of our thinking, and also thinking that, okay, this is what we need to do, be more proactive about sexual health, normalizing sexual health and family planning, especially sexual health. Like you say, we would not be around if we didn't, if sex wasn't relevant to everyone in the main. So it's very important that we take our sexual health very, very, very proactive about it, while we try to have this sort of conversation and discussion to normalize it, raise awareness, and also talk about the key things and how things are going forward with sexual health and family planning. On that note, Mel, I'd like to say thank you so much. I keep saying Jane before. So thank you so very much, Mel. Thank you for your time. Thank you for having a chat with me. If you need to know more about the organization that Mel works for, it's called Family Planning Association. They're one of the biggest in the UK. You can go online or just actually put on Google fpa.org.uk, I think it is, so that you would find out a lot of work that they do, how you can access their services, if you need any information or anything like that. I find their website in the main very, very useful. So check it out and see what you can get out of it. If you need to listen back to the recording, or if you're listening to a replay, please feel free to contact us on ABN Radio UK on Twitter, Facebook, and also Instagram. If you have any topics, any questions, any queries, any feedback or about what we've talked about today, or if you want to join me on the show, so please be in contact and let me know what sort of topics you would like to talk about, and I can see how I can get you on the show to talk about anything health, well-being, health, social care, well-being, and anything in between. My name is Fatima Kamara. Thank you, Mel, for joining us. I hope you found the show in the main very useful. Please feel free to share and follow ABN Radio UK on social media. Thank you very much. Now, in closing, I know that last week and this week has been for some people, very exciting, for some people in between. The GCSE A-level results and O-level results came out last week, A-levels, and I'd like to say well done to everyone who's taken the A-level results, who have made it to the university of choice. And if you haven't, there's always hope for next time. Use the clearing system. There's always the second chance for you to go to your second choice even, so make use of that. And well done. I want to say well done to a special lady, Miss Leanne Time. Well done for everything you've done. And for the GCSE O-levels came out yesterday. I am still buzzing, I have to say. I normally don't put my stuff out there, but I would this time, because my son had his O-level result and he did exceedingly well, and I'm still buzzing from the excitement. And it's been a journey. I feel like I've also taken the exam mentally with him. So well done to Jermaine, and well done to Aaron, who had very, very good result, Aaron Time as well. And well done to everyone who did the A-level exams results, who had the exam results last week for A-levels and this week for O-levels as well. As we're talking family planning, young people, there's a really good there are lots of young people out there doing this stuff. Well done, keep it going. And well done. I can't say it enough. So keep it up and keep the good work up. Now, I hope you all have a wonderful and very good bank holiday weekend and a good weekend. My name is Fatima Kamara, your host for the Health and Wellbeing Show. Until next time, I'm normally with you on Fridays at 11. Keep tuned in, and thank you for joining me. Thank you once again.
get to your one. Ah, boy. Ah, boy. You know what time it is. Ah, boy. Now. Yeah. Ah, boy. Big nation. Ah, boy. Yes. Ah, up in the bomb ready. Stone boy. Yeah. And Casa. Let's talk do more. Me a roll up meeting in a me corner. Them the spread rumor. Rasta Beji Magana. Pick up the ghetto you them from Honolulu to Ghana. Yeah. See we the born two more. I get in our nose it's on ya. Any man try kill me vibes. Gonna work with them. I know them.